Hi, thanks for joining me for this week's Movement in Anatomy, where we get to explore the nature of our muscles moving in our bodies. I'm super excited to be able to share with you how our muscles move and be able to feel it in your own body. And just remember that as we go through these muscles of the posterior and anterior body, they don't move in isolation. We're kind of learning them muscle by muscle and the movements that they do, but they have helpers, synergist muscles and antagonist muscles that work, in opposition or with them, and the body is never moving in isolation. We're going to start with that trapezius. It's one of the larger muscles, superficial muscles on the back, big triangular upside down triangle muscle on the back, and it has the action of lifting our shoulders. Right? Sometimes we carry a lot of tension in our shoulders, and it's often our upper traps. It also hugs the shoulder blades together. We can squeeze the shoulder blades together. And if we continue down onto the back side, we have that latissimus dorsi, which is another big muscle that spans the back. And it is responsible for that extension of the arm. Now, it also works in synergy with the teres major muscle, which is underneath the armpit. So together they work on extension of the arm and medial rotation, pulling the arm more medially. Now, the latissimus dorsi also adducts, right? Adducts assists the arm in pulling it towards the midline. So let's go on to the deltoid, which has three different origins. Anteriorly, it inserts on the clavicle, and laterally, it inserts on that acromion. And then the posterior, it inserts on the spine of the scapula. And so it's a rather large shoulder muscle, or arm muscle, and it's responsible for anteriorly, it flexes the arm, it abducts the arm, and it extends the arm. So we have lovely motion with that deltoid. All right, we're going to come down to our bellies for that erector spinae, which is extension of the spine. And I'm just going to leave my hands back. What I love about extension of the spine is you can access by lifting the chest and lifting the thighs off the floor. As high as we can lift, we're really using those erector spinae and extending the spine. We draw the belly away from the floor and then release it back down. And then we have we have three rotator cuff muscles that are on your list. We have our three of the four rotator cuff muscles. First one is your supraspinatus muscle, which lies in the supraspinous fossa, right up on top. It's responsible for abduction of your arm. And then you have your infraspinatus muscle, which lies on the infraspinous fossa on the posterior side of your scapula, and it's responsible for lateral rotation. And then you have your subscapularis, which lies on your subscapular fossa on the anterior side of your scapula, and it's responsible for medial rotation. So we have infraspinatus, subscapularis, and supraspinatus. We have a few muscles that work on that retraction of the scapula and protraction of the scapula. And, we said trapezius retracts the scapula, and so does the rhomboideus major, or rhomboid major, pulls the scapula towards the midline. They have that retraction. Now, if we start to move towards the anterior muscles, we notice that protraction of the scapula, which is the separation of the shoulder blades, the scapula, away from each other. We have pectoralis minor, which assists in that protraction of the scapula, and serratus anterior, which also assists in that protraction of the scapula. So retraction, we have that rhomboid major and trapezius, which hug in towards the spine, and pulling away, we have our pec minor and our serratus anterior. It's a movement of the scapula sliding along the rib cage. So if we come back towards sitting, we're going to talk about the muscles on the anterior side of the body. And, an important one is the sternocleidomastoid muscle. Kind of comes from the occipital region of the skull and then comes down towards the clavicle and the manubrium. And the great thing about this is it's a great one to palpate and feel. If you turn your head to the one side or the other, you start to feel the muscle. You can kind of feel it. You move your head, you can feel the other side. It's this nice ropey muscle that comes down. It is responsible for lateral rotation and also flexion of the neck. Moving on down to our pectoralis major. It lines the clavicle, originates around the clavicle, and comes down also into the humerus, intertubercular sulcus of the humerus. And down towards the sternum. It's a rather large muscle that aids flexion of the arm and adduction. So a perfect example is our push-ups. They really work our pectoralis major when we're doing a wide push-up. So coming down to our backs, you're going to leave the knees bent here. And you're going to find a nice neutral spine so that there's a little curve in the low back. It might be slightly lifted off the floor, but there's no pain in the low back. Relax the shoulders, let the back of the neck be nice and long. We're going to talk about the muscles that make up the abdominal muscles. So we have our six-pack abs, which are the most superficial of the abdominal muscles that lie on top. It's our six-pack abs. It really originates from the bottom of the rib cage to the pubic bone. And so when we flex our rectus abdominis, we're really bringing the lower ribs towards the top of the pelvis. So we're shortening the distance. So if we just lift the head and the shoulders off the floor, maybe bring the hands behind the head to support the head so that you don't have to use your neck muscles to help you lift. Let the head be heavy in your hand as you lift the chest, and then you draw the low ribs closer towards the top of the pelvis. So here we have that action of flexing the trunk. And we're flexing the trunk. Now, what happens a lot of times when we just are flexing the trunk is we get this little bread loaf, they call it, right in the center. And what that is our transverse abdominis not being activated. So we want to think of that transverse abdominis that wraps all the way around from the spine all the way around to the front in a corset fashion, and that we can hug in towards that center and like you're going to brace for a punch. You want to just kind of hug in towards that center. Already start from there, and then lifting the chest, pulling the low ribs towards the pelvis. Then we kind of eliminate this bread loaf kind of pulling up. I want to think of pressing down, squeezing in towards that center, and then releasing. And then we have our internal and our external obliques, which align the sides. They have this cross fiber effect, right? We have our external obliques which run down, and our internal obliques which kind of run up in this direction. And there are really stability, well, a transverse abdominis is a stability muscle. It really stable for our breathing and our spine, our low back, our back muscles. And our external and internal obliques also are stabilizing muscles, but they also assist in lateral flexion. So if you were to move your hands from side to side here, and you're squeezing from side to side, you're utilizing those obliques. Right, so we have the rectus abdominis, flexion of the trunk, internal and external obliques, lateral rotation. They also assist in our flexion of the trunk as well. And then we have our transverse abdominis, which is that bracing in, like you're going to, somebody's going to punch you in the gut and you want to brace for it. We have that stabilizing muscle there that helps in our movement, it helps in our spine, and it also helps with our breathing. So those are your ab muscles, muscles of the anterior body, muscles of the posterior side of the body. Thanks for joining me today. Have a wonderful day.